As we've been telling you, after Thanksgiving, Rhode Island will enter a 2-week pause where restrictions will be tightened. Some businesses will close, others will need to lower their capacity. National public health expert Dr. Ashish Jha discussed the pause today with Steph Machado on the latest episode of Pulse of Providence. Jha is the Dean of Public Health at Brown University. Steph joins us now with what he had to say about Rhode Island's current situation.
Dr. Jha says depending on the data, indoor dining could be the next thing to close in Rhode Island. He says schools should be the last.
I think 2 weeks is sort of that bare minimum.
Dr. Ashish Jha, who leads Brown's School of Public Health, says there should be some data at the end of the RI pause to determine what to do next. Governor Gina Raimondo announced last week the state would go into 2 weeks of restrictions after Thanksgiving from November 30th to December 13th. Gyms, bars, casinos, colleges, and more are closing to in-person activities, while restaurants, retail, and houses of worship will stay open at reduced capacity.
Is there evidence that indoor dining with masks off is safer than a gym or a fitness studio?
Yeah, the evidence on this is a little bit mixed. We do know that gyms can be a source of spread, and especially because in gyms, people are obviously working out, they're breathing hard, and the harder you breathe, the more virus you exhale. The key issue on dining is how crowded is it? Obviously, full indoor dining right now would be a disaster. But the question is, if you pull it way back, have only 25 or 33% of capacity, can you make it safer? And I think the answer is you can. And if you want to be purely focused on keeping the virus to, as low as possible, you might close indoor dining.
While teachers' unions have been pushing to close schools, Jha says with masks, some distancing, and ventilation, schools are generally safe. New York City decided to close its schools last week because the city hit a 3% positivity rate. On Monday, Rhode Island's rate was nearly 6%.
I have not seen any clear threshold beyond which I would close schools. I think New York City closing their schools at 3% just doesn't make any public health sense. If you're going to close schools, my goodness, it should be the absolute last thing to close, and it should be the absolute first thing to open.
And coming up at 6, what Dr. Jha says about celebrating Thanksgiving safely. You can also watch the full episode of Pulse of Providence. It's on WPRI.com. Right now, we talk about Rhode Island's testing capacity, the impending vaccine, and more. I'm Steph Machado, 12 News.
Governor Gina Raimondo and the CDC are urging people not to travel for Thanksgiving and to stay with their households. But Rhode Island did issue an exemption to the new social gathering limit over the weekend for people who live alone. Those folks can gather with one other household. 12 News reporter Steph Machado asked an expert on the coronavirus pandemic for his advice to avoid spreading the virus on the holiday. She continues our in-depth coverage.
The governor acknowledged not everyone is going to follow her Thanksgiving rules, and she can't police living rooms. Dr. Jha says there are ways to mitigate the spread of the virus at the dinner table.
I am worried about the Thanksgiving holiday weekend.
Dr. Ashish Jha, the Dean of Brown's School of Public Health, says Thanksgiving this year is a risk continuum.
If you want to be the safest, have dinner with your household. If you've already committed, you're going to go see family, there are things you can do to make it safer. Again, one thing you can do is if you have 2 or 3 families getting together, maybe while you're eating, have them eat separately and keep windows open. Wear masks as much as you can indoors. The safest thing would be to try to eat outdoors.
After the holiday weekend, Rhode Island enters its 2-week pause, limiting activities until December 13th. Jha says there is reason to be optimistic that vaccines will help decrease the spread of the virus in our area early next year.
I expect that by the end of January, if you believe the target set by Operation Warp Speed, 50 million Americans will have gotten vaccinated. That's about 16-17% of the population. I expect that in Rhode Island, by that time, we'll have probably close to 20% of the population may have already been infected. And you combine them, obviously some overlap, 30-35% of people may be immune by then. Even by the end of January into early February, we will start seeing the spread of the virus slow way down.
And in the full episode of Pulse of Providence, Dr. Jha talks about what the data shows about the safety of gyms, restaurants, and schools. That is online right now on WPRI.com. I'm Steph Machado, 12 News.
Now your pinpoint weather.